Hi everyone, I am Dr. Mansi Jani. I am an international board certified lactation consultant, infant and young child feeding counselor at Apollo Hospitals, Navi, Mumbai. In today's session, we will be discussing about some common breastfeeding related issues which are encountered by new mothers with respect to a newborn's aspect. In our last video discussion, we have covered about the breastfeeding challenges which may occur from a maternal aspect and how to overcome them. The video link for the same is given in the description. Do watch it at your convenience and gain all the information. Let's go ahead with discussing about what issues can be faced with respect to a newborn. The most important point that I want to highlight here, which is faced by every new mother right after the delivery, even if it's a vaginal delivery or a cesarean section. The most common issue faced by almost every mother is how to position and latch the baby correctly, and if the latching and position is not right, how it leads to challenges and discomforts related to breastfeeding, maybe even end of a breastfeeding journey within few days or few weeks right after the birth. So this is a main important challenge which needs to be addressed, which needs information, more information and guidance on how to do it correctly and what can be done. Right after the birth, if it's a cesarean section, it is difficult for a new mom to sit upright and start feeding immediately. Feeding can be initiated in lying down positions or side turning positions with assistance of a lactation consultant or a nurse. Once you have completed your day 1, your second day onwards, you can start sitting on a chair or on the bed sitting upright and position the baby correctly onto the breast, preferably with the help of pillow supports at the back and the front. For moms who have undergone normal delivery, you can breastfeed in the sitting position just right after the birth, maybe in a couple of hours, sooner the better. Good pillow supports at the back and the front really help you to get more comfortable, and your baby can also latch well onto the breast when you have good support under your hands and at the back. There are few different techniques and holds in which you can latch the baby correctly onto the breast. If one position is not working for you and baby, try the different position. There are a couple of positions on how to correctly latch baby. We will be taking a separate video on the same with demonstration, so that it is easy for you to understand what are the positions, what are your options, and how you can easily latch the baby onto the breast right after your birth and soon as possible. Sooner the better actually. The most common rules of breastfeeding which you should be aware related to positionings and latching is baby needs to be completely turned towards you. In any position you are latching your baby, positioning, baby needs to be completely turned towards you so that baby's tummy is touching your tummy. Baby's face and head is exactly opposite to the breast. And preferably baby's body angle is a little bit diagonal so that the head angle is slightly above than the legs angle. This diagonal position, turning towards you, completely touching your body, helps baby easier to latch onto the breast and to suckle from the breast well. Also, it gives a good bonding, a good thermal contact, a good energy, a heat exchange between you and baby so that baby doesn't feel cold. The challenge faced for the positions and latching the baby in the early days is because the baby does not have a good neck control. Newborns, they gain good neck control, the ability to hold the head and look sideways and look towards someone. They develop that after 2.5 months. So really in the first 2 months, you need to get your positions and techniques right under guidance so that you can smoothly breastfeed for the first 2 months till the time baby develops a good neck control. So your first and foremost point is baby needs to be completely turned towards you, completely held in your arms properly. There are different positions we will be taking up in the next video. Once you overcome the position and latching issue, it becomes really easy for you to frequently breastfeed the child onto the breast because baby is going to ask for feeds every 2 hours, even more times. So my next issue I want to talk about is I have heard about this a lot in my extensive clinical practice, almost every day by a mother, that baby feeds frequently, baby feeds only for a little while, sleeps off, then again asks, then sleeps off, then again asks. So this happens over an interval of 3 to 4 hours. The term for this is called as cluster feeding pattern. Especially newborns, they have this cluster feeding pattern, as they are also not efficient with breastfeeding. They are also not aware of their own strengths, of how well they can breastfeed, how easily they can breastfeed onto the breast. Also, their stomach size is very small. In the early days, their stomach size is like a small cherry. So they cannot hold more milk into their tummy. So they would drink from the breast, they would digest the milk, they would again ask for the breast in some time, breast milk in some time. This is called as cluster feeding pattern. You would observe this especially from the second day onwards, more often in the night time. First day after the birth is also known as birthday nap, where babies are mostly napping. You may have observed this, and from the second day onwards there is a complete flip and baby frequently asks for the breast in a cluster feed pattern. Let me tell you, this is a normal feeding pattern because baby is also learning. Baby also needs to be brought frequently onto the breast so that baby also gets better. It will get better with time and practice. Baby would get efficient and baby would understand its own needs and demands and how well to take from the breast. So it is recommended for you to allow the child to frequently latch onto the breast, especially during night times, because that is the time when your hormones are at the peak which produce more milk. So it is actually a good thing that if baby latches frequently onto the breast, you can produce more milk in a faster way. It becomes really exhausting when a baby is continuously asking for the breast at a break of 10 minutes or half an hour. So I recommend you to choose comfortable positions. Get a good lactation guidance just in the early 1-2 days. Establish your correct positions and latching so that for the cluster feeds it is easier. You are aware which position you will be taking, which position is comfortable for you and baby, and you can continue the marathon sessions, especially in the night time. Because this will be really helpful for you to be comfortable throughout these sessions. Otherwise, just imagine if the latching and positioning is not correct, the baby is unable to latch onto the breast and drink properly, and baby is having a cluster feeding pattern. So it is just increasing your exhaustion. It will just increase your fatigue and your tiredness with sleepless nights and with a crying baby. So your first 2 points, these are the most common challenges observed, and these can be recovered. These are common, these can be recovered. There is answer to this. Getting a correct latching position related guidance, especially in the early days, and practicing it through. You and your baby are definitely going to be getting better with this and getting more efficient with it with time and practice. Next I want to talk about is tongue ties and lip ties. For some babies, you may have noticed there is a tight band, a tight strip of skin tied from underside of the tongue to the floor of the mouth. What happens with this is it restricts the baby's tongue. Because of the tight band here, it restricts the baby's tongue to move forward properly or to move along the sides of the mouth or even touch the upper side of the mouth properly. So baby is really unable to use the tongue effectively to hold on to the breast and drink well from the breast. So what happens in this is, first thing, you will encounter with frequent nipple related injuries, nipple cracks, soreness of the nipples. Baby won't be able to latch onto the breast properly, so baby would snap. Baby would frequently come off the breast and start crying, and it would be really disturbing for a new baby to understand how to take the breast, especially with a restricted tongue mobility. And baby won't be able to breastfeed effectively, so you would have to frequently give some additional milk to the baby, maybe in the form of formula milk supplementation and all that. It would really interfere with breastfeeding. So what my recommendation here is that right after the birth, get the pediatrician and the lactation consultant to evaluate your baby's mouth and oral tissue, the tongue mobility and everything, so that you are well aware if baby will be able to breastfeed properly, in which positions baby will be able to breastfeed properly. So mostly with these tongue ties and lip related tight bands, it is common for babies, and mostly babies are able to breastfeed effectively also. Not all bands are really tight to restrict so much. Only a few of them. So if it is getting evaluated just right after the birth in the early stages, we can take the corrective steps in as a matter of how to latch the baby, which position will be helpful for you and baby, so that it doesn't create pain, so that baby's tongue restriction doesn't interfere or doesn't much come in the way for easier breastfeeding sessions. So this is also a very common challenge, and if you are aware right after the birth during baby's mouth evaluation, then it will be easier for you to overcome this. Next I want to talk about is oral thrush. Again a common challenge. This especially starts after second and third week after the baby's birth. Second and third week into breastfeeding, if there has been some fungal infection inside baby's mouth, you would notice white patches inside baby's mouth, especially on the tongue, on the sides of the mouth, on the gums, everywhere. These are white plaques or white fungal infection known as oral thrush. It is also a common challenge. It would interfere with breastfeeding in the terms of when baby latching onto the breast, the baby would pass a cross infection onto your breast. It would lead to a fungal infection on your nipples, leading to cracked nipples, soreness, pain, pinching, pricking type sensations onto the breast. So it becomes really difficult with a fungal infection to continue breastfeeds effectively. So I recommend, if you notice any white patches onto the baby's mouth, or if you're having frequent nipple related pain, discomforts, aching during breastfeeding, after breastfeeding, get a consultation done with your pediatrician, with your lactation consultant, and correct treatment can be given for baby to apply inside the mouth and for you to apply all over your nipple, and get the correct guidance on if you're latching the baby correctly. So all these things will help you to recover from the thrush. Again, it would be only there for a couple of days. As you start on with the optimal treatment for the same, you would definitely recover and you can get back to your breastfeeding journey in a more smoother way. Next challenge we have noticed is if a baby has developed cleft palate or a cleft lip at the time of birth, then it also becomes difficult as a challenge. It's a big challenge in itself to latch the baby onto the breast. What is the meaning of cleft palate or a cleft lip is, due to certain developmental issue, there is a gap in between the lips or the palate, and it does not form a seal onto the breast. It's not correctly developed. So baby is unable to form a seal onto the breast. Air may keep leaking and baby may keep snapping off the breast. Baby may not be able to drink properly as baby is not able to hold the breast properly. Also, there is a risk of aspiration because the baby may not be able to drink properly inside the mouth because of the cleft. Then there are chances it may reach to the windpipe. The milk may reach the windpipe and cause breathing related discomforts for the child. So this also gets evaluated at the time of birth, and correct steps can be taken as advised by your pediatrician. And there are methods to latch, even with a cleft palate, even with a cleft lip, there are methods to latch baby onto the breast. Different techniques can be tried. If baby is not able to latch onto the breast, there are different methods in which we can provide the milk for the baby, making sure there is no risk for baby's airway or any nutrition or any other discomfort. So this is also a common issue noticed. So if you are facing this issue, I recommend you to get in touch with your pediatrician, get in touch with lactation consultant, and understand what techniques and what methods are right for you and your baby till the time you recover from the cleft related issue for baby. Next, again a more common issue I want to talk about is preterm babies. Preterm newborns which have been delivered before their term, which have not completed their term, and they have been born before the term, they can be admitted in the NICU setup, they can be with you. Even if they are with you or in the NICU setup, there are certain challenges in itself which these babies face, related to suckling, related to swallowing of the milk, because their mouth or the oral anatomy may not be well formed or may not be having good enough strength to continue breastfeeds for a longer period of time or to even continue breastfeeds frequently. What may happen is they may not be able to latch onto the breast properly, may not be able to put enough oral strength to stay latched on for a longer period of time. So they may not be able to complete a feeding session onto the breast. More skin to skin contact, correct techniques of latching the child onto the breast, and providing more expressed breast milk to the baby will really help the baby to recover from the early phase till they have reached their term age after the birth, and they gain the weight, because preterm babies, it is observed that the baby is a little lower on the weight side, so they take a little bit more time to breastfeed efficiently. They are definitely able to do it. They have all the sucking and all the swallowing reflexes present at the time of birth. It's just the baby needs time, care and attention to breastfeed well. With the correct guidelines, with the correct techniques, we can definitely make it possible. And you definitely require good support to feed a preterm child by taking proper attention onto the child's techniques, how the baby is feeding, by burping the baby properly, making sure of a good diaper count. That will help in a good weight gain, so that baby gains weight in a better manner and baby comes back to the breast and breastfeeds well effectively. It will work easily. So this this session was all about the baby-related challenges which are commonly observed and which are commonly faced by the newborn and the new mother. My key message here is do lots of skin-to-skin contact with your baby. As a baby is born, try to put the baby onto your skin and bond with the baby as soon as baby is born. More skin-to-skin contact will make the baby more familiar with you, would make baby understand your body, understand your breast properly, and it would initiate baby's primitive reflexes to latch onto the breast and to feed effectively. So skin-to-skin care is very important right after baby's birth. And latch the child as soon as possible, preferably in the first hour of birth. Even if it's a vaginal delivery or a cesarean section, take assistance, get a lactation consultation, and latch the baby in the first hour of birth so that we can go ahead easily on our breastfeeding journey if a baby latches right in the first hour of birth. Frequently continue latching the baby onto the breast. Get guidelines on which position, which technique, what is going to work for you and baby, and continue practicing it, be consistent with it and continue doing it every 2 to hourly in the early days so that baby also gets used to it, you also get used to it. Like any other activity, breastfeeding also gets better with time practice. Imagine learning to drive. Just on day one, none of us would be really efficient with driving and we would not know what we are supposed to do, how we are supposed to do. But as we give our time and practice and as we do it daily, one day we get really better with our driving and we get really confident. This is just a similar way, taking an example of driving. So giving time and practicing is really important. And one more important additional thing is avoid giving external feeds to the baby unless required. If a pediatrician or lactation consultant has recommended you to give external feeds to the baby, only then. Otherwise, try to keep baby more of skin to skin and try to breastfeed frequently in the correct techniques. This would help you to overcome maximum of the challenges which are commonly encountered. We will be taking a few sessions with demonstration on how to correctly latch and position the baby onto the breast, and furthermore certain topics we will be taking up. So stay tuned, keep watching this space for more and get in touch with us if you are having any other lactation related queries or baby feeding related queries. We are there to help you. Contact on our numbers provided and meet us at Apollo Hospitals, Navi, Mumbai. Thanks for watching.